And our final talk before coffee is from Chris Jones, a valedictory talk to this gathering. Chris was a cardiologist in Bridgend in the 1990s, essentially set up Bridgend cardiology in the 1990s, moved into medical management 20 years ago, came and disentangled some of my problems in Cardiff, and then has adopted us as one of his missions within Welsh Government over recent years. Any cardiologist seeing patients admitted on no secondary prevention would blow their top in cardiology. It's just not done. Everybody goes home on a whole pocket full of secondary prevention and medication after a cardiac event, but that just doesn't happen for most of our patients. So he's understood the problem.
Thank you very much. It's a pleasure to be here. I am of a certain age, and I have therefore a continuing interest in how the NHS in Wales progresses and develops. And I do feel that fracture liaison services and the work that you're committed to and the journey that you're on is an absolute exemplar for the type of NHS we want to have. We want an NHS, I would say, I want an NHS, which is committed first and foremost to the quality of care and the safety of people in our care. And that means avoiding avoidable harm wherever possible. And there's no better example of avoiding the avoidable harm of osteoporotic fragility fractures than you've heard today from the excellent talks that I've heard just this morning. So I think you have a chance with the consistent investment across Wales that is in place now to deliver the elements that Kazim described, of good project management, continuous service improvement, measurement, and in a way articulating the impact of your actions. And I think you are an exemplar for what I would like to see as kind of consistent national approach to secondary prevention across a range of chronic conditions. I think we have to be honest, it's difficult right now. We're reeling still from the pandemic. Money, although there's a lot of it, in theory, is difficult. And there's also disproportionate public focus on a few measures, like the longest people waiting on waiting lists and also cancer percentages. And so it's not surprising that these are attracting kind of a lot of attention prior to the election. But I do hope that the conversation can be a more normal, proper conversation in time. And as I say, for me, a focus on avoidable harm must be at the centre of our endeavours. And a focus on avoidable harm will help us deliver our strategy. We have a good strategy, a healthier Wales. It describes a service, an integrated service that isn't all about hospitals, where avoidable harm is avoided. So people don't have to go to hospital unnecessarily, don't spend longer in hospital. They can be managed closer to home where possible, and they have better outcomes. So from a secondary prevention point of view, I would like to see a national approach to cardiovascular secondary prevention, and I think that would have to incorporate a national approach to blood pressure management, a national approach to atrial fibrillation, a national approach to optimizing care in heart failure. I'd like to see a national approach to the proper management of diabetes, the delivery of all the key processes that we know make such a difference to outcomes for people with diabetes. And I'd like to see a national approach to the prevention of diabetes in those who've been demonstrated to be high risk. There are other areas as well, but basically what we want is an NHS where if there is evidence of impact, we follow that evidence and we implement to the best of our ability so the outcomes are the best that we can achieve. There's also a lot of work to do to avoid avoidable harm in hospitals. We know that particularly the elderly for whatever reason they may go into hospital, they do really badly in hospital because of deconditioning, loss of mobility, independence, and ultimately, they go to care homes, they become part of the social care burden, sadly, and they don't live the last few months and years of their life in the way that you and I would want to. So we must do more on frailty, prevent people who are frail getting into hospital. Fracture liaison services are a key part of that. But when people are in hospital, we must make sure we do not allow people to become deconditioned. And there are other harms that we know are avoidable, but still do happen in hospitals. Healthcare-acquired infections, complex, unnecessary healthcare. Sometimes we dish out healthcare as if it is free, completely free, doesn't cost anything. Let's dish it out as much as possible, often on the basis of just in case, maybe to protect myself. But I think we need to be a little bit more patient-focused in our approach and put the person at the heart of our activities and do everything we can as a system to make sure they get the best possible outcomes. I would like to observe the NHS in Wales changing, evolving, maturing, so it really does focus on the best possible outcomes at every point in the system for everybody in Wales. So thank you very much indeed. I look forward to watching your endeavours.
So, thank you, Chris. The continued interest and support from the government, what we have seen today, is exemplary, and it allows us to work together, create new services, and deliver the care what our communities need.